So on that note, I would like to introduce Kelli Young, who is an occupational therapist, registered psychotherapist, and registered marriage and family therapist, and registered sex therapist, and Brigitt Degeus, who is a master's of social work, registered social worker at Toronto Rehab, who will be speaking on sexuality following brain injury. Thank you so much and welcome.
Thank you.
Thank you. It's great to be here today. And Mary was saying, just as we were talking just before we came on here, and Ellen was saying that this is not a topic that you've had before presented. So we're excited to be your first. And we were also saying that we are not all that surprised that this hasn't been addressed before, and probably for many of you hasn't been addressed even in your own healthcare settings. So we'll talk about some of the reasons why that is, and hopefully we can help to make some changes in that regard. So we hope that by the end of this presentation, you will be able to understand a little bit more about the effects of acquired brain injury on your sexuality and on your intimate relationships. Another objective is for you to be able to feel a bit more comfortable talking about your sexual concerns and your questions. And we hope that you will leave with some helpful strategies to improve your sexual functioning and your intimate relationships. So let's get all on the same page about what we're talking about when we talk about sex. This guy says, we took off our clothes. I got on top of you. How long till it starts to feel good? And she says, I don't know, but I've got a headache already. And actually, probably looking outside, probably many of us have headaches today based just on this weather. Some of you will recognize, this is a picture of Sue Johansson. She is a very well-known and well-regarded Canadian sexual health educator. And for many of us, she came into our high schools and talked about birth control and condoms and sex and sexuality. She was really a trailblazer in her time. Still is, actually. She's in her 90s now. She coined the phrase, sex is perfectly natural, but not naturally perfect. And she actually wrote a book by the same title. So this quote notes that sex is by its very nature a little bit confusing and kind of ambiguous. So let's turn to the World Health Organization and see what they have to say about what sexuality is. So they say sexuality is a central aspect of being human throughout our life and encompasses sex, gender identities and roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. And let's just kind of broaden that a little bit. So sexuality is natural. It's part of being a healthy person, to have a healthy sex drive, sexuality, what have you. Sexuality is fundamental. It's a fundamental part of just being human. It is physical, it is emotional, it is spiritual, it is cultural, it is psychological. Our sexuality is connected to our sense of self-worth, self-esteem. It's connected to our roles and our ability to give and receive love and affection. Our sexuality is experienced and expressed in our thoughts, in our behaviors, our beliefs and attitudes, our values, our practices, and our relationships. And any of you who might have taken a basic psychology course might remember Maslow's hierarchy of needs. It was like a triangle of needs, and right down at the bottom of that triangle are what he refers to as our basic survival needs. So things like food and shelter. However, interestingly enough, sex and sexuality is also right down at the bottom of that triangle, that hierarchy. So it is considered a basic survival need. What it is not. So sexuality and sex is not just intercourse. Now, for many people, intercourse is an important part of their sexual experience and their sexuality. However, it's not the only part. And I think even in healthcare, we make the mistake of assuming that when people are talking about sex, they're just talking about intercourse. And for many people, particularly those with injury or with health concerns, intercourse can become quite problematic, can become difficult, and even impossible. Additionally, if we're thinking more diversely, thinking more in terms of, for example, the LGBTQ population, sexuality is defined so much more broadly than just intercourse, and intercourse might actually not even be part of the equation. So it's important for us when we're talking about sex, when we're talking about sexuality, when we're talking about sexual relationships, that we speak quite broadly in terms of the various types of sexual activities that can encompass that. Sexuality is not just a separate entity that we can just split off from the person and say, well, that's not important anymore, because for most of us, it is important all the time. And maybe it falls off the radar sometimes, but it still is fundamental to who we are as people, as human beings. It's not, similarly, it's not absent in the face of illness or disability. It may become lower on the priority list for a time, but as we'll talk about later, it's certainly for most people comes up there again. And it is definitely not adequately addressed by healthcare practitioners. And this is a real problem because what we know from the research is that patients identify their sexuality and their sexual functioning to be one of the most important quality of life issues. So again, I'm so happy that we're addressing it today and hopefully breaking down some barriers in that regard. So speaking of barriers, why is it that sexuality isn't addressed, isn't talked about? Well, some of those barriers are particular to patients or to sometimes we call them clients. So those can be embarrassment. For many of us, we didn't grow up speaking about sex and sexuality very openly. So it can be kind of embarrassing to talk about those issues, especially with somebody that maybe you don't know very well. Certainly in hospitals and in many rehab settings, there might be a lack of privacy. Sometimes you just have a curtain separating you from the person next to you. The walls are thin, so it can be difficult to talk about what can feel like a private matter in a less than private setting. Most often patients or clients are waiting for their healthcare professional to bring it up. They think to themselves, well, if this is an important matter, or if I have a right to talk about my sexual concerns and questions, surely my healthcare professional will bring it up. But as we'll talk about in a second, that's actually quite often not the case. There may be a lack of knowledge about what is normal in terms of sexuality and sexual functioning, especially during illness or aging. And sometimes we're dealing with both aging and illness. For many people, there's a stigma or a taboo attached to sexuality, and that can make it very difficult to talk about. And for those people who are seeking therapy for their sexual concerns or their relationship concerns, unless that therapy is happening in a OHIP run facility like a hospital, there's often a cost to that, and that can be prohibitive for some. And then looking at healthcare provider barriers. So like I said before, quite often patients or clients are waiting for the healthcare professional to bring it up. And quite often healthcare providers are waiting for the patient to bring it up. So one's waiting for the other and then it just doesn't come up, which is really unfortunate. There may be a lack of time, so very busy health professionals running around, seeing many, many patients or clients in a day. Sometimes we just have 10 or 15 minutes for one patient or a client. So this is an area that often requires a little bit more time to get into the issues in some depth to feel like they are being addressed. Same thing about the lack of privacy. Even healthcare professionals, we're people too, and there may be a lack of knowledge and training. Our own attitudes, values, and beliefs can make it difficult or uncomfortable. Most of us, I know in OT school, Christina, there's an OT student who's observing this. We didn't get very much. I think we got one lecture about sexuality, and when I have spoken to medical students and other health professionals, they too have received little or nothing by way of training in the area of human sexuality. So it's not surprising that quite often people don't have the answers. So I'm going to turn it over to Brigitt, and she's going to talk specifically about some of the issues specific to acquired brain injury and sexuality. And then we'll come back and we'll start to talk about some tools and strategies that might be helpful. So take it away, Brigitt.
Wonderful. Thank you so much. And thank you for everyone who's attending and for this opportunity. So I want to begin by just acknowledging that I did have some colleague support in putting this together. Karen Beekenkamp, who's a social worker in the stroke program, as well as some of these slides were also taken somewhat from another clinician. We worked together, Karen Gann. And so it's sort of an amalgamation of a lot of people working together. It is an important topic, and so I will certainly do my best to present issues related to acquired brain injury and sexuality. So if we can go to the next slide. So the definition, what is an acquired brain injury? And I'm pretty sure that most people watching this can answer this question through their own experience. But I did go to the ABI network for the definition of what is an acquired brain injury. And so what we're looking at when we talk about an acquired brain injury is basically either injury caused from a medical situation or a disease of some kind. So it's a non-traumatic brain injury. In other words, it may have been caused by a stroke, anoxic brain injury, or possibly multiple sclerosis, or some other medical issue that impacted the brain. So it was more of an internal type of impact. Whereas we also look at the traumatic side of a brain injury, and those are more sort of from an external situation, maybe a car crash, a fall, intimate partner violence, sports-related injury. So when we talk about an acquired brain injury, those are the two areas that we are specifically focusing on. Okay, next one, Kelly. So as we know, and I want to say before we talk about the different impact that an acquired brain injury has on a person, what's really important to keep in mind is the extent of the injury, the type of injury. So for example, someone who may have sustained an injury in a car accident may experience what's called coup contre coup. So in those situations, there might be multiple areas of the brain that have been affected versus someone who maybe has sustained a stroke, where the type of injury might be very localized. So the impact of the ABI may be different for very many different people. Also, what impacts a person also depends on who they were prior to the injury, their lifestyle before the injury. So there could be a number of factors. But generally what we find is as a result of an acquired brain injury, people may experience physical changes. Now that may vary, and we're going to go through some of what may be those physical changes. Communication changes. How do we talk about what we feel, what we think? What are we hearing? Fatigue. We talked earlier how for some individuals, this type of weather really impacts their level of energy and endurance. Pain, another one. Cognitive changes, emotional changes, personality, and behavioral changes. So we're going to break it down as we go through, keeping in mind everyone is different and everyone will experience some of these issues to some degree. And then, of course, how those particular areas impact our ability to have relationships with people, intimate relationships. And I might mention just a little bit about just sort of family and friendship relationships, but keeping in mind that the focus, of course, is around partners and sexuality and our ability to relate to others. Okay, let's go on to the next one. So I did my best to try to make it all come together, but you'll be patient with me, I'm sure. So a brain injury does impact relationships and sexuality. We know it has psychological effects, it has medical and physical impacts, and it changes relationships. And in the middle, or the three circles overlap, and of course it impacts intimate relationships and sexuality. And we're going to break this down even further. If I'm going too fast, please let me know. So who can tell me what is the ultimate sex organ? Anybody? I know there's Wayne and Billy. I don't know if you want to give it a shout or we can just move on. Okay, we'll just keep going. So what is the ultimate sex organ? Next one, Kelly. It's our brain. Now, this is a really, I think, is a very complex and involved slide, but it gives you the sense of how many parts of our brain are so important to the issue around sexuality. So, for example, we have the, I don't have I want to point, but you won't see me pointing, the cerebellum, for example. You know, it is involved in emotional processing and control of movement response. Or we have that little almond-shaped part of the brain called the amygdala, which is also involved in emotions. We have the parietal lobes, which are involved in sensory, touch, smells, all those issues related to our senses. And then, of course, we have the prefrontal cortex that is important, you know, the frontal lobe, the biggest part of our brain, and it deals with issues around initiation, planning, organizing, control of our thoughts and our behavior. Okay, so, and of course we have the hypothalamic nuclei, which is involved in issues around hormones and responses involved in reproduction, sexual desire, lubrication, ejaculation. So the brain is all connected. You know, it works together like a very well-oiled machine. And when one area is affected, you can kind of get a sense of how maybe something else might be affected as well. Okay. Next slide. Yeah, please. So let's talk about some of the physical changes that might happen as a result of an acquired brain injury that also impacts and affects our sexuality. Changes in strength and coordination. Ability to activate the right muscles to move the way you want to move or to stay in or change your position. Changes in sensation, touch, the feel of touch. Oftentimes, what may have felt good prior to the injury may not feel the same after an acquired brain injury. Okay, even with muscle and changing positions, your tolerance for certain positions may not be as strong as it was prior to. Changes in endurance and increased fatigue. So sometimes just being too tired to engage, to be intimate, or even just to spend time with someone. So these are very, you know, top, I mean, there's a lot more, but there are a lot of physical changes that can impact a person's sexuality. Now, I do want to say that here at the Rumsey Center, the great thing about being here is that we can tap into occupational therapists, physiotherapists, sometimes neuropsychology. And I can tell you that some people who have stepped up to say, you know, intimacy and sexuality is still really important to me. However, because of, you know, the hemiparesis, I'm weak on one side, I really don't know how to manage this. And we find it's very much a team approach. My role might be more around how do you talk to your partner about what your needs are? And then I have physio and OT who talk about the functional part of it. So how do we manage the positions? But certainly dealing with these particular issues requires a real big team approach. Okay, Kelly, next one. So other physical changes might be, again, really impacted by your endurance, shortness of breath. Some of the physical/medical issues that may result from an acquired brain injury might be seizures and risk of seizures. So you might be feeling a little bit more apprehensive. What if? Hormone changes, again, where your libido might be impacted, or your energy level, or you just don't have the drive. It might also be impacted by depression, and we'll talk about that later. Aging, for all of us who are getting older, it does change and impose on that a type of injury. It can also change, it can maybe sort of accelerate things as well. Again, fatigue, pain, and sensitivity. Okay. So of course, even though we're looking at areas sort of in a little bit of a silo, you will see by the end that really they all come together and they all impact each other. So in acquired brain injury, there are some cognitive and emotional changes that can impact sexuality, relationships, and so on. Motivation and initiation difficulties. So if the frontal part of the brain has been injured, you may verbalize a desire to engage, but there's no initiation, right? There's no idea of how am I going to do this. Sometimes you may find yourself verbalizing it, but not knowing what to do. Another change is called disinhibition. So sometimes as a result of a brain injury, prior to a brain injury, most of us have sort of, imagine like a wall, and we kind of watch what we say, and sometimes we can think certain things, but we don't let it out, right? However, with an acquired brain injury, sometimes that wall or that filter wall comes down a bit, and sometimes things slip out. Okay, so our verbal filter, maybe even our behavior filter, may not be as strong as it was prior to the injury. At times, you may find yourself saying things that normally you wouldn't have said. And of course, this can really impact your relationships with people. Sequencing difficulties. Where do I begin? How do I get this started? How do I finish it off? So again, it's all very cognitive, knowing where to begin and how to end. Attention. I know maybe you might be thinking, well, I'm being intimate. I can pay attention. However, sometimes it may be difficult staying on task. Memory deficits. Oftentimes I experience working with families or couples where the person with the brain injury may say, I don't remember having an intimate evening with you, or I don't remember those things. And so sometimes that can impact, the relationship, because one person may not be recalling special moments or even conflicts, things that have not been resolved. So for the person with the brain injury, they don't no longer exist, but for the other person, they're still holding on to it. And that can impact relationships. Okay, Kelly? So some other issues to think about: difficulty understanding another person's point of view. Can we be empathetic? Does it impact our ability to really understand what the other person is experiencing? Changing communication. Sometimes you experience, I know what I want to say, but it's not coming out the way I want it to say. Or I heard what he or she said, but I understood it differently. And all those can definitely impact relationships. Changes in mood and emotion. I guess it's a little bit of bias of mine, but I find that that's such a significant issue for people if they're feeling, a lower self-esteem, lower self-confidence. They may not have a strong libido, or they might just, their self-image. I used to be this person and now I've changed. Who am I? How do I relate with my partner? So all of these issues, these changes in mood and emotions impact sexuality and sexual relationships. Okay. I hope I'm not going too fast. You'll let me know with a little bit of a hands up. So of course we do have these other emotions that come into play because of the experience of change, unwanted change. We might experience anger, anxiety, will my partner still want to be with me? What happens if I can't perform? Embarrassment. change in body image. Will my partner find me attractive? I'm not as attractive as I used to be. A sense of guilt. Maybe I can't perform the way I used to. Loneliness. A sense of grief and loss. There is a strong sense of grief and loss in an acquired brain injury because you've changed. You're still present, but you're not the exact same person you used to be. So you might feel some sadness. You may not feel like yourself. As I mentioned earlier, your body image may change and you may feel unattractive. In addition, there might be some personality changes as well as behavior changes or even thoughts, right? Prior to, you may have been a little bit more confident, assured of yourself. You know what you liked. And now you're relearning all of this. And that can certainly have an impact on your relationships. So how you feel can impact the relationships you have with loved ones. Kelly? So this is a little bit broader, but it does take into account also that there is an impact on also the people around you. When sort of the trajectory of recovery with someone who's had an acquired brain injury does also impact the well-being of the partner who's also going through the same journey. And there might be a change in stress, in their health, and also their mood because they're also dealing with grief and loss. Prior to the injury, your partner and you, there was a good match. There was a good synchronicity. You were getting along. You had conflicts. You resolved them. You were attracted to each other. But now everything has changed, right? Your desires may not match. Maybe because there's been physical changes, you're relearning how to love and care for this new person, even how you communicate with each other. It's not only the person with the brain injury who's looking at how do I communicate, but it's also the partner or the family member, the friend who's saying, how do I connect with him or her again, with them? How do I get my needs across as well? So the change is quite significant. Next one, Kelly. And at times in that trajectory, in that recovery, our roles change. Prior to the injury, maybe the husband, the male, was the breadwinner, was the one who fixed everything. I'm doing it's a bit traditional, and I apologize. But maybe there was one person in the relationship who kind of took care of all those things. But now that person has been injured, depending on the extent of the injury. The other person in the relationship is doing more caregiving. There's a loss of equality in the relationship. It's no longer you do this and I do this, not 50-50, but now it's more like 20-80, whereas the other person is taking on more roles than they had before. And like all relationships, finding time to be intimate, even spontaneity now has decreased. Why? Well, when you think about pain, fatigue, maybe today was a plan that you were going to be intimate with your partner, but you woke up not feeling well. Maybe you have a headache. Maybe there's pain being activated. Maybe you're very sensitive to the weather. So again, intimacy, sex isn't always spontaneous. It can require a lot of planning. And of course, because there's been so much change, there is also this fear of what if my partner doesn't want me? Or what if I do something wrong? And it's a relearning for both people involved. And for each of you, you may sometimes even feel like you're with a different person. And what does that feel like? And how do these encounters now feel when your husband, your wife, your partner, your mother, your father, your son, your daughter just seem like a different person in the sense of, obviously, don't get me wrong, the sexual encounters are between adults, but even just in talking with each other, I am with a different person, and how do I relearn, relove this person, this new person that I'm with? Okay, next one, Kelly. Okay, so I know we're waiting at the end for questions, so if there are any, I'll hopefully be able to answer them afterwards. Okay, tools and strategies.
Thanks, Brigitte. So we've spent a considerable time so far in this presentation talking about difficulties and challenges, and we did that on purpose because we wanted to validate that for many or most of you, even that there are those challenges, there are those concerns, and you have an absolute right to feel concerned and worried and have questions about your sexuality. So we wanted to spend some time validating and sort of elucidating what some of those issues, questions, and concerns might be. But we also wanted to have some time to talk about the things that you can do, the tools and strategies that you can do to make sex more fun, for it to feel better, for you to improve your sexual self-esteem and self-worth. I am aware of the time, and I know we do want to leave time for questions, so I am going to sort of fly through, if you will, through many of these strategies relatively quickly, but we will have time at the end for questions. And like Mary said, this presentation will go up on the YouTube channel. So one of the most important things that you can do is to start to talk, start to communicate. I work in mental health, and the main thing I do in my work is talk to people. And so I come from, I think Brigitte does too, the position that talking helps. So try to talk to a member of your healthcare team that you feel comfortable with. And also, based on what I said earlier, given that some healthcare professionals also don't have a lot of information or knowledge or training about sexuality, make sure that person that you're talking to feels confident, feels comfortable, feels like they have the information that they need in order to help you. And if they don't, that's okay too. But ask for somebody who does. Ask them to refer you on to somebody who can talk to you, who can answer your sexual questions and address some of your sexual concerns. If you have a partner or partners, invite them to join in on some of these discussions so that they too can have their questions answered. Also, because this can be an uncomfortable or overwhelming topic, sometimes when you're alone with your healthcare professional or with somebody else, and you have a brain injury on top of that, you can forget what is talked about. So it's good to have somebody else there with you who might be able to remember to take some notes. When you're with your partners, to be open, to work on being more open about your feelings and your fears, your hopes, your sensation. And Brigitte went through a whole variety of those that you might be having at any given time. And then practice asking for what you want, what you need, and what you enjoy. And this, particularly with a brain injury, might require some planning ahead. So when something pops into your mind, to maybe jot it down so that when you go to have this discussion with your partner or partners, that you feel prepared to address the questions or the concerns or the issues that you want to talk about with them. It can also be really helpful to talk to a close friend or a confidant and to consider joining a support group. Now, you'd be hard pressed to find a support group specific probably to ABI and sexuality, but you can probably find a whole bunch of support groups where difficult concerns, including sexuality, can come up, particularly if you raise it. And if you raise it, you'll most likely notice that other people also have questions or concerns. So medications, many, both prescription medications and just regular over-the-counter medications like antihistamines, for example, will and can have sexual side effects. And these can include a whole variety of sexual side effects like reduced sex drive, reduced vaginal lubrication for people with vaginas, reduced genital sensation, erectile dysfunction for people with penises, and that's the ability to get and maintain an erection, or delayed or reduced orgasm and ejaculation. Antidepressants and anticonvulsants or anti-seizure medications are notorious for having sexual side effects. So ask your doctor or your pharmacist. Pharmacists are great when it comes to medications. They're actually the experts. So talk to them about the possible side effects of the medications that you're taking, both the over-the-counter and the prescribed medications, because it might be possible for them to suggest other medications that you could take that maybe have fewer side effects. And that's often the case, that there are other medications. And also ask about the schedule or the dosage of the medications that you're taking, because quite often these can be modified so that they can have fewer sexual side effects. So, for example, if you prefer to be sexual in the late afternoon or evening, for example, and you take your medications at that time, it might be possible for you to move your medications to earlier in the day so that you won't notice the same side effects or as bad side effects later in the day when you're wanting to have sex. That's an example of how you might be able to modify things.
Kelly, I just wanted to say
Go ahead.
with regards to that, I know that individuals who sustain traumatic brain injuries are often, they find themselves with a lot of those different types of medications like anti-seizure medications or antidepressants, anti-anxiety. Certainly, I guess just to add on to what you were saying is they may have some side effects around sexual performance. And certainly never just stop cold turkey. It's always really important to have that discussion, because
Yeah,
it
that's an
may be, yeah, it may be one of the issues that's causing the changes. Yeah.
Yeah. Yeah. Never stop or change your medication regime on your own. Make sure you're consulting your pharmacist or your physician before you do that. Energy conservation is a big one. So we've talked about fatigue being a really common consequence of having a brain injury. So making sure that you conserve your energy as much as possible is really important. So for example, avoid having or leaving sex for the absolute end of the day after you've done your laundry and what have you, when you're feeling really zapped of energy. Instead, try to plan to be sexual earlier in the day or at a time when you're more likely to have more energy. Like, for example, if you are able to take a nap or on the weekend. Try as much as possible to get a good night's sleep, take naps when you can. If at all possible, get some help with your housework or childcare, grocery shopping, other tasks that you need to do in a particular day. If somebody can help you, that would help with your energy. And try different positions for sexual activity, which is the next slide. So changing your positions, and again, we're not just talking about intercourse or penetrative sex, but positions for any kind of sexual activity can help you to reduce or eliminate pain, can help you to adapt for limited mobility or range of motion, can reduce pressure on incisions or prostheses or catheters. Also, if you don't have a lot of strength or energy, changing your position can help you to feel like you have some more energy. Um, if you are engaging in penetrative activities, changing positions can allow one partner to have better control over the speed and the depth of penetrative activities, which can be important, particularly if you have pain during penetrative activities. Also, sometimes people feel a little bit more self-conscious in one position or a little bit more exposed in one position over another. So changing can help with body image concerns. And just generally, it's more fun and you can have more variety if you're just moving around a little bit more. Anything that we can do to improve our overall health will also have a very positive effect on our sexual health. So, for example, eating a healthier diet, if you smoke or drink a lot of alcohol, to try and stop or reduce that, getting as much exercise as possible, and just doing your best to think more positively. And we'll come back to that in a minute. Sexual lubricants can be a great addition to people's sexual activities, and I basically encourage everybody to use a sexual lubricant because it just makes sex more slippery and more fun. Sexual lubricants also just supplement a women's own natural vaginal lubrication. They minimize dryness and pain during sexual activity for people who notice that they otherwise have quite a lot of friction. So it can help to reduce this friction and also just increase pleasure overall. And these are some examples of sexual lubricants. You don't need to go anywhere fancy or even into a store to get them. You can just go to your local pharmacy, Shoppers Drug Mart, Rexall, what have you, and go into it's usually in what they call the family planning section, and you can pick up a sexual lubricant. And we have talked about various ways of thinking and trying to change your negative thinking, because feelings about your own sexual attractiveness will and often do affect your sexual desire and your sexual satisfaction. So remember that most often you are your worst critic. And so it's helpful to try to work on being more self-compassionate. Like today, when it's a rainy day and you wake up having a headache, sometimes you're not up for an hour-long webinar or what have you. And that's okay. Focus on areas of your body that you like and find attractive, whether that's your hands or your hair or maybe your legs or what have you. And try to balance negative thoughts with more positive or even neutral thoughts. And I know that's easier said than done. However, there are many cognitive behavioral or CBT strategies that can be very, very helpful in this regard. And you can get workbooks with CBT strategies that help you to reframe the way that you're thinking into a more balanced or neutral thought. And a really good one is called Mind Over Mood. I have it right here, by Greenberger and Podesky. It's a very user-friendly manual that takes you through how to recognize these negative or unproductive thoughts and how to start to change them. Self-pleasuring, or what some people call masturbation, we want to note that that is a very normal and healthy activity, whether you are single, in a relationship, divorced, widowed, what have you. It's a very normal thing to do. And it helps you, after a brain injury, helps you to get to know your body again. Because like Brigitt was saying, many things change in terms of your sensations, the way you're thinking and what have you. So engaging in self-pleasuring can help you to rebuild your self-confidence, get to know what feels good for you so that you're in a better position to then teach your partner. Sex toys, so toys aren't just for kids, so sex toys add some fun, some variety, some excitement, and also Brigitt talks about how quite often sensation changes with brain injury, and combined with aging, our sensation starts to change, and quite often we need more intense types of stimulation in order to become aroused and tip us over into orgasm. So sex toys can be very helpful in that regard. And then finally, for some therapy can be helpful, whether that's individual therapy, therapy with a partner, or group therapy, because it can help you to really dig into some of those negative ways of thinking, to learn to express your feelings and process your feelings, process hurts. Some people have experienced traumas in addition to the traumatic brain injury. So therapy can be very helpful in this regard. And if you're looking for a certified sex therapist, the best place to go to is the Association of Sex Therapy in Ontario, or ASTO. So if you just Google Association of Sex Therapy in Ontario, you'll come up with the website. And on that website is a list of certified sex therapists. You can go into that list and it will give you all of us who are certified, where we work, and our various areas of expertise and specialty.